Patient-reported outcomes with Selpercatinib among patients with RET fusion-positive non-small cell lung cancer in the Phase 1/2 LIBRETTO-001 trial. Libretto 001 is an ongoing, global, open-label, Phase 1/2 study of Selpercatinib in patients with advanced or metastatic solid tumors. We report interim patient-reported outcomes in patients with RET fusion-positive non-small cell lung cancer, NSCLC. Patients completed the European Organization for Research and Treatment of Cancer Quality of Life Questionnaire, QLQC30, version 3.0 at baseline, cycle 1, day 1. Approximately every other 28-day cycle until cycle 13 and every 12 weeks thereafter. Data were evaluated through cycle 13 as few patients had reached later time points. A change of as greater than or equal to 10 points from baseline in domain scores was considered clinically meaningful. Among 253 Selpercatinib-treated patients, 239 were categorized into subgroups by prior therapy. Treatment naive, N equals 39, 1 prior line of therapy, N equals 64, or 2 or more prior lines of therapy, N equals 136. The QLQC30 was completed by greater than 85% of patients at each time point. Most patients overall and in each subgroup maintained or improved in all health-related quality of life, HRQOL, domains during treatment. The percentage of patients who experienced clinically meaningful improvements ranged from 61.1% to 66.7% for global health status, 33.3% to 61.1% for dyspnea, and 46.2% to 63.0% for pain. The 61.1% of patients with improved dyspnea had 2 or more prior lines of therapy. Median time to first improvement was 3.4 months. At the first post-baseline evaluation, cycle 3, 45.9% of all patients reported a as greater than or equal to 10-point reduction in pain. In this interim analysis, the majority of patients with RET fusion-positive NSCLC remained stable or improved on all QLQC30 subscales at each study visit, demonstrating favorable HRQOL as measured by the QLQC30 during treatment with Selpercatinib.